Hello human beings, hope you are doing good. The purpose of this video is to create awareness and to impart knowledge about endotracheal intubation and mechanical ventilation to the general population. So what is endotracheal intubation? It is a process by which an artificial tube is inserted through a man's mouth into the lungs so that we can give breaths, that is oxygen, to this patient using a machine called mechanical ventilator. It is done only by doctors and experts in the field. In an emergency, it is a life-saving procedure. But when and why do we need this procedure? There are multiple situations where intubation is needed. Some of the most common ones are when a patient is unable to breathe due to block in the natural airway, that is throat or larynx or the trachea. It can occur due to trauma, road accidents, drug allergy, etc. Unable to breathe due to lung diseases. Sometimes when the lungs are unable to function properly, the doctor might suggest mechanical ventilation. The patient might be unconscious or in coma or somehow he or she is unable to breathe due to some other conditions in the body. Still, we might need mechanical ventilation. And during surgery, usually during a major surgery, the patient is made unconscious and all the muscles in the body, including the respiratory muscles, are relaxed temporarily by an anesthetist using drugs. In this situation, he or she uses a mechanical ventilator to give oxygen to the patient. These are the few most common reasons why a patient is intubated. Mechanical ventilation is indeed a great gift of medical science. However, there are disadvantages too. During mechanical ventilation, in order for the patient to cooperate, the doctor will use drugs like sedatives, muscle relaxant, etc. And this mechanical ventilation is also a huge stress on the patient. So there is always a risk that after starting mechanical ventilation, a patient may not make it back alive. In many cases, we can never know how long a patient will need mechanical ventilation, especially in an emergency department. And it is very expensive. Since it requires a lot of equipment, expert handling and a 24/7 monitoring, it is very expensive. And depending on the place, the hospital and the quality of the service they provide, it can vary anywhere from 8,000 to 50,000 rupees per day. It is a life-saving procedure and sometimes the procedure has to be done within a few minutes of the patient entering the hospital, and so the treating doctor may not be able to explain everything to the relatives in time. So fellow humans, the goal was to give some idea about mechanical ventilation and endotracheal intubation. And if you like to listen more like this, please leave a comment and thank you for listening. Thank you for watching. Bye bye.